Hi everyone, welcome to my channel Capsa. Today we will learn about a very interesting topic related to local anesthetic, that is method of administration of local anesthetics and their clinical uses. Okay, so today's topic is method of administration of local anesthetics and their clinical uses. Okay, so the first method is surface anesthesia. Now, this kind of anesthesia actually applied to superficial layer of skin, mucous membrane, etc. And the main chief target is sensory nerve endings. Okay, so this kind of anesthesia is applied to superficial layer of skin, mucous membrane, etc. And the main target is sensory nerve endings. Okay. Now, which kind of drugs we can use? Which form of? This can be solutions form, ointment form, cream, spray, etc. So, form of drug we can use, that can be solution or it can be ointment, spray, cream, etc. Okay. Now, where it is applied? Actually, it is used for the nose surgery, kind of mouth, urinary tract surgery, etc. So, clinical uses are nose, mouth, or urinary tract. And what are the drug of choice? These are lidocaine, tetracaine, benzocaine, etc. Now, the second procedure is infiltration anesthesia. What is infiltration? Infiltration means when you applied local anesthetics, it goes from the surface to the deeper part. If this is the surface part, this is the deeper part. When you are applying local anesthetic, it will go into the deeper section. That is infiltration anesthesia. So, for this purpose, local anesthetics are injected into tissues to reach nerve branches and their terminals. Okay. So, applied to tissues. So, reach nerve branches and terminals. Okay. Now, how we can achieve this type of anesthesia? Just insert the needle directly into the exposed subdermal layer of the area you want to anesthetize. And this kind of local anesthetics can be given intradermally, subcutaneously, or submucosal. Okay? So, given intradermally, subcutaneously, and or it can be given submucosal. And it mainly used for minor dental surgeries. And the drug of choice are lidocaine or lignocaine, procaine, bupivacaine, etc. Okay. Now, the another one is that is nerve block anesthesia. In this technique, L is the injected tube close to the nerve trunks and achieved the nerve block anesthesia. So, L is injected close to nerve trunks to achieve this kind of anesthesia, and mainly used in dentistry or in dental surgery. Clear? Drug of choice are lidocaine or lignocaine and bupivacaine. Now, the all three things we have studied, that is surface anesthesia, infiltration anesthesia, nerve block anesthesia. We understand these three through a picture. Okay. So, let's assume this is a skin layer. Okay. This is a nerve and these are the nerve branches. Writing this. This is Lufus, layer of. So this is the nerve, this is the layer of skin. When we are applying local anesthetics to this part, that is surface anesthesia. Okay. When we are applying local anesthetics into this part or the branches, nerve branches, that is infiltration anesthesia. And when we are applying to a large portion like this, that is nerve or field block. Okay, sorry, that is field block type of anesthesia. And if we apply anesthesia by enclosing the whole nerve to affect this nerve totally, that is nerve block anesthesia. Okay, clear? Now the next one is fourth one, that is regional anesthesia. What happens in this anesthesia? It actually achieved by injecting LS intravenously or IV and the most distal venous portion of a lower or upper extremity. So where it is applied? It is applied in the IV route to the most distal venous portion of lower or upper extremity. Now we need to be clear about what do you mean by upper or lower extremity. So upper extremities are these are arms, shoulder, and hands. And lower extremities are hip, leg, and toes. It means it is actually applied for arm or legs surgery. Okay, and the drug of choice are prilocaine or prilocaine and lidocaine. Interesting fact is, it is also known as Bier block, which is named after a professor of surgery lives in Berlin named Karl August Bier, who applied this technique in 1908, okay, or 08. Now, we will understand the fifth procedure, that is spinal anesthesia. In this procedure, local anesthetics directly injected into the subarachnoid space and used in the pelvic surgery. L is injected into the subarachnoid space and used in pelvic surgery. Okay, and the drug of choice are lidocaine. It is more preferred drug, and we will write in decreasing order of use, like then articaine, then bupivacaine, prilocaine, and the last one is mepivacaine. This is the decreasing order of use. Okay, and the last one is that is epidural anesthesia. And this kind of anesthesia is achieved by applying local anesthetic, injecting local anesthetic into the epidural space and used in labor. Used in labor. Okay? And the drug of choice for this purpose are levobupivacaine, or it can be used like levobupivacaine and ropivacaine. So these are the drug of choice. Now we will understand these two anesthetic procedure through a picture. Let's draw a picture. I am not good enough in drawing, but I will make you understand. These are the lumbar part, okay? 2, 3, like this. Okay. This is your spinal cord. Okay? And this part is your dura mater. And this part is subdural space. And this part is the epidural space. Okay? So, what is spinal anesthesia? When you are applying anesthetics to this layer, this is subdural space, that is spinal anesthesia. And when you are applying anesthesia to this part, that is epidural anesthesia. Why this is epidural? Because if this is your dura mater, the upper part of dura mater and the space is known as epidural space, and the upper layer is known as epidural layer. In this space, because epidural anesthesia applied, so that's why known as epidural anesthesia. Okay? And spinal anesthesia is applied to the subdural space. You can see here, this is your spinal cord. I'm highlighting this. This is your spinal cord. Okay. This is your dura mater. This is your subdural layer. Okay. And when you are applying local anesthetics to the subdural layer, that is spinal anesthesia. Okay. So this is the end of my lecture. If you like my video by ignoring my drawing, please do like, comment, share and subscribe. Thank you for your